Difficult MDT decisions in follicular lymphoma occur because it's such a heterogeneous disease. So some people never need treatment, and I think that this is one of the things I wanted to highlight, that we mustn't overtreat this group. A fifth of patients never need treatment throughout the whole time they have this diagnosis. But then looking at options for patients who have low-level disease, and that really we are now allowed to give them single-agent Rituximab 4 weekly for advanced stage asymptomatic disease, and that might not be what we would wish to do for every patient, but it does delay time to next treatment. And so might be some patients who, maybe older patients in their 80s, that we would be concerned about giving chemoimmunotherapy in years to come, and it might be that group would be a good group who we could target earlier with treatment with Rituximab. So within these, I used 5 case presentations to look at difficult cases and what discussions around it. So I then went on and looked at the frontline options for treatment. We have different chemotherapy backbones, different antibody combinations, whether maintenance is the right thing to do, bearing in mind that there are toxicity data associated with it. And although there is progression-free survival benefit, the 10-year follow-up from the PRIMA study did not show an overall survival benefit. And then finally, I looked at the relapsed refractory patients, talking about the higher risk patients, those who progress within 24 months, and how we know they do badly and how we need to intensify treatment for them, maybe consider consolidation therapy as well. And just finally wanting to highlight that what would be fantastic, and in the future for improving patient outcomes, we can identify these higher risk patients up front. We can pick out the ones who aren't going to need treatment. We can pick out the ones who hopefully we could use more intensive treatment. And therefore for others who are going to do well, give them minimal treatment with minimal toxicity.